Good evening, everyone, and thank you for joining us. Before we get started, I want to share a few brief housekeeping announcements. First, we would like to thank everyone who submitted questions in advance of tonight's town hall. We hope to address many of your questions over the next hour with our panelists. And if you have additional questions or need clarification, please use the Q&A function in Zoom. And as a reminder, this is a public forum, so anything you type will be visible to others. Tonight's town hall is being recorded and streamed live on Facebook. Please feel free to share the link so that others can tune in, and we will be pasting the Facebook Live link into the chat just in a moment. And finally, a recording of tonight's event will be available on the Montgomery County YouTube page, and we will also send that link out to everyone who has registered. And now I will turn it over to our moderator, Dr. Richard Lorraine.
Good evening, everyone, and welcome to our first for 2023 Ask the Experts Immunization Program. This is presented by the Montgomery County Immunization Coalition in conjunction with the Montgomery County Office of Public Health. And this is an ongoing series, but it's our first for this year, and we look forward to having more for this year as well. This one this evening is specifically on pediatric immunizations, and it's also in honor of National Infant Immunization Week, which is April 24th through April 30th. I am your moderator for the evening, and we will be joined by our panelists, a distinguished group of medical professionals from the Delaware Valley area. And that would include Dr. Michael Harkness, who is a general pediatrician with Nemours Children's Health, Dr. Angela Nicholas, who's the chief medical officer of Einstein Medical Center Montgomery, and Dr. Stephen Shapiro, the chairman of the Department of Pediatrics at Jefferson Abington Hospital. The timetable for this evening, we will do some brief introductions, and then we'll get right to some questions that have been submitted ahead of time. We'll be going around in turn and going through all of those questions. That will take us to roughly 7:45. At that point, we will also look to take additional questions that you can enter this evening by putting them into the Q&A at the bottom of your screen. And we will take as many questions as we have time for. And about 7:55, we will then start a wrap up and just summarize what we've done for the evening. And hopefully we'll have given you some significant information that you can use for yourself or for your child's health care. So we'll start with introductions, and I'll briefly introduce myself. I'm Dr. Richard Lorraine. I'm the medical director of the Montgomery County Office of Public Health, and I'm a general internist, been in practice in Montgomery County for about 38 years. In addition to those two positions, I'm also commissioned as a colonel in the New Jersey Air National Guard, and I command the 108th Medical Group at Joint Base McGuire. And Dr. Harkness.
Yes, thank you. I am a general pediatrician with Nemours Pediatrics in Paoli. I've actually been in pediatrics. I'm working on, I think, 42 years now. I was with Mainline Health for a while and now with Nemours. And just a general pediatrician who's done hospital medicine, but mainly outpatient medicine the last 30 years.
Thank you. And Dr. Nicholas.
Good evening, everybody. I am Angie Nicholas. I'm a family physician, and I'm in a practice in North Wales, Pennsylvania, as part of the Jefferson Einstein group now. And I am also the chief medical officer at Einstein Medical Center Montgomery and the chief clinical officer for the North region of Jefferson.
Thank you, Dr. Nicholas. Dr. Shapiro.
Good evening, everyone. Steve Shapiro. I'm chairman of pediatrics at Jefferson Abington Hospital and private pediatrician in private practice in East Norwich in PA for at least 43 years and hopefully a little bit longer.
So you can see we have quite a bit of medical experience on the panel tonight. So we'll start with the questions that have been submitted ahead of time. And Dr. Shapiro, the first question is for you. I've heard that the CDC recently updated the COVID-19 vaccination recommendations. Can you share the updates on the COVID-19 vaccines as they pertain to children?
Great question, whoever submitted it. This is a work in progress, ladies and gentlemen. Work in progress by the very nature of the fact that we now have so many versions and so many different criteria for immunizing our children that that it's gotten a bit complicated. So I've tried to boil this down to a short answer, and then if you have any additional specific questions, just put them into the chat room. But first thing I want to talk about is what are the new bivalent boosters, and why has that now become part of the normal compendium of vaccination processes for all age children. The current bivalent vaccine blends what's referred to as the ancestral COVID, SARS-CoV-2 virus with the various Omicron variants that you have read about and heard about on the news, the BA4 and BA5 variants, all blended together into a bivalent booster. And that's now been recommended for the final dose of either series of vaccines, whether your child receives the Pfizer vaccine or the Moderna vaccine. As far as the variations between Pfizer and Moderna, let me just say that the Pfizer is a 3-dose series. The Moderna is a 2-dose series. The key element is not so much how much time you need between dose 1 and 2 or dose 2 and 3. It's how much time you need to leave yourselves from the final initial dose to the booster dose. And we need at least an 8-week window to then give the bivalent booster dose, as I previously described. Now, the thing that you should remember, and this is the take-home point, either vaccine, both vaccines are immunologically equal. So whether your doctors provide you with the Pfizer version or the Moderna version, please don't worry at all in terms of whether or not your child has received optimum immunization strategy. The data that has been combined, that has been looked at, shows that immunobridging, which is the technical term that you need to see in a way that defines how much immunity is given by the vaccine. The immunobridging studies demonstrated that both of the vaccines were equal in their effect. So I'll stop there. It's a very complicated algorithm now, but if you have a specific question about your child or something, I'm happy to answer them. But that's the 10,000-foot view of what is different. We now have bivalent boosters, and they are part of the regular sequences for either the Moderna or the Pfizer vaccine.
Thank you, Dr. Shapiro. I'm just going to also add, for those of you who might have heard about another vaccine from Novavax, that vaccine is not approved for use in children. So our next question will go to Dr. Nicholas. Can you share your thoughts on the impact that COVID has had on pediatric and adult vaccinations that are given in practice?
Oh boy, this is a topic very near and dear to my heart because COVID really affected all really important preventive health maintenance. Not only vaccines, but cancer screenings, pretty much everything. I think what we found was in the beginning, especially, people were very reluctant to come into the office, put aside routine health screenings and health maintenance. And as a result then, because parents weren't necessarily bringing their children in at the routine scheduled times, that they got behind. So got behind on the routine vaccines, got behind on the routine pediatric dental screenings, got behind on your routine health, doctor's appointments. And so it's been a while, and it's taken a while for everyone to catch up. I think what we found is, in, let's say, a newborn, we'd see that newborn at 2 weeks, at 4 weeks, at 2 months, 4 months, 6 months. As the pandemic was happening, I think people were getting, again, further and further behind on taking their children in. So then we were having to figure out what we were going to do with the vaccines. And in addition, everyone was, at least in my practice, anticipating a COVID vaccine and then getting nervous about, well, what do we do with the COVID vaccine? And long story short, the COVID vaccine took a little bit of a longer time for pediatrics. So the long and short of it is that a lot of our children in our practices got behind on their vaccines. And we're just at the point now where I think we're getting everybody caught up to where they should be. If you believe that your child is behind, your family doctor or pediatrician would love to talk with you about whether they're behind or not and really get them caught up. In some circumstances, if you missed, for example, a 4-month visit, my hope is by now you would have caught up and had your 4-year visit. You would have had a 5-year or 6-year visit, and we'd have gotten you all caught up by now. But please, please, please talk with your family doctor or pediatrician. Let's make sure that your children are all caught up on all of their vaccines and all of their preventive screenings for everything that we do for your children.
Thank you, Dr. Nicholas. That's a very important point. Dr. Harkness, next question for you. And this is one that we could have probably devoted the entire time to, but we'll have to keep to the few minutes that we have available. How safe is the COVID-19 vaccine, and what is the long-term impact on children?
Well, that's a really important question, and probably the question most in the mind of our parents who are talking about COVID vaccines. The fact that most vaccines generally took about 4 to 10 years to get to market, and this came out in less than a year from being able to figure out the sequence of the virus, had everybody a little concerned. Actually, what happened was because the pandemic was proceeding at such a dangerous pace. We have to remember how scared we all were in March and April of 2020, when everybody seemed to get COVID and died. The government put their efforts into getting this vaccine out as quickly as possible without shortcoming any of the safety measures. So all of the normal phases that vaccine development goes through, phase 1, phase 2, phase 3, were all completed, and they were all completed in their regular time. They were just done simultaneously instead of one after the other after the other. And so we did, when we finally did have the vaccine, we had all of the safety data on the people that the patients that were given the vaccine, and it turned out to our wonderful surprise that the vaccine was not only very effective but was also very safe. And in using it now for over 2 years, and giving, there's been 670 some million doses of the vaccine given from when it first came out to the beginning of March. And we have been just thrilled at the fact that there's been very few side effects. You do sometimes get some local swelling, you do get some fevers, some people will say that they feel knocked out for a day or two, they feel a little fatigued. But the side effects in general have been really, really mild and have been short-lived, usually gone within 1 to 3 or 4 days. There have been some severe side effects. There's the risk of anaphylaxis or an allergic reaction, which can happen usually within 15 minutes of getting the vaccine. That happens about 2 to 5 times per million doses. So it's not very common, and most people will have people wait after getting the vaccine for 15 minutes to ensure that they don't have an allergic reaction. The big reaction that people talk about is myocarditis. That's something that's kind of come up in the news and come up on social media sites. That's an inflammation of the heart, or pericarditis, inflammation of the lining around the heart. That is something that has been seen in higher numbers, but it's mainly in a specific age group. It's mainly in males. It's mainly in kids between the ages of 12 and 24, and it's mainly after the second dose of the vaccine. So that has been happening. It still happens less often than you see myocarditis with COVID. And the myocarditis associated with the vaccine is much more mild. It generally sometimes will require hospitalization, usually for a day or two. It's treated with anti-inflammatories. There have been no reported deaths from the COVID vaccination in terms of myocarditis. There certainly have been deaths from myocarditis from COVID, but no deaths from the COVID vaccination causing myocarditis. And there have been no cases of myocarditis from the vaccine in children under the age of 5. So it has proved to be incredibly safe. You may have heard about things like blood clots with the vaccine. That only happens in the J&J vaccine, which is not generally given to kids. Same with Guillain-Barré syndrome, which is a neurologic thing. That's also not something given to kids. So generally, we have been really thrilled with how safe it is. In terms of long-term effects, I think the things that people were most worried about is when the vaccine was in development, there was a lot of concerns about, what are we doing with this mRNA? It sounded too much like genetic engineering. And, we had visions of, movies where we were turning people into monsters. Turns out it's actually the science behind it is pretty straightforward. The mRNA is a copy that's made from DNA. It cannot revert back to DNA unless there's certain enzymes available, which COVID doesn't have and our cells don't have. So the mRNA that you get is gone in the system within about 2 weeks. It cannot change your DNA. It cannot get into your nucleus and damage your DNA or cause any kind of permanent genetic changes. It's just physically impossible to do that. There also was concerns initially about a protein that was in the vaccine, in the lipoprotein part of the vaccine, that was similar to a protein in the uterus and in the placenta in pregnant women. And that was a concern that it might be dangerous for pregnant women. That has turned out not to be true. There's no cross-reactivity between the vaccine protein and the uterus protein. And in fact, there's been no problems with there's been no problems with any stillbirths or premature births or genetic or birth defects in kids whose moms have gotten the COVID vaccine. There has been some people who say their periods, some women say their periods have been off for a month or two after getting the vaccine. We're not quite sure why that happens. It might be a stress response, but that's temporary and there's nothing permanent about it. So generally, we have been really happy with the safety and we're really confident there's not going to be any long-term safety concerns.
Thank you for that very comprehensive response, Dr. Harkness. I do want to emphasize one particular point that you made in regards to efficacy. So understand that the purpose of the COVID vaccine, and there was some confusion about this initially, but the purpose of the COVID vaccine is to decrease the severity of the illness, not to prevent the illness. And it has been extraordinarily successful. If you look at the graphs that show the difference in hospitalizations between people who are vaccinated and unvaccinated, to this day, there remains a very, very significant difference. So the vaccine is effective in decreasing the severity of the illness. Thank you. Back to Dr. Shapiro. Should I vaccinate my child if they've already had COVID?
Well, thanks to Dr. Harkness and Dr. Lorraine, you've heard the answer, ladies and gentlemen. Not much really earth-shattering news in the fact that vaccines work very effectively to decrease the severity of the disease that we're talking about. Were your child to have had an episode of COVID infection, the antibody that the child will have built against COVID, the virus, is good and will keep that child protected, but not for an extended period of time. And with the addition of the vaccine, that will trigger not only an immune response in the child's body, but also begin to offer memory to the longer lasting cells in the lymphocyte series that'll give the child some memory against COVID. You're actually giving the child a better opportunity, giving your child, I should say, a better opportunity to be fully protected. I think we've accomplished a great deal with the vaccines, as Dr. Harkness and Dr. Lorraine said. This is nothing short of a miracle that we were able to save so many lives by administering this vaccine with the urgency that we have accomplished.
Thank you, Dr. Shapiro. One other thing that I'll add to that I often explain to patients in the office, to understand why having had COVID does not prevent you from getting it again. If you think of the other diseases that other coronaviruses cause, they are basically colds. So my question always is, have you ever gotten a cold? And then have you ever gotten another cold? And the answer, of course, is yes. So having had COVID will not protect you for forever from getting COVID again. You can get it again. There will be a period of time, as Dr. Shapiro mentioned, where you will have some additional immunity from the antibodies produced from that illness, but you can always improve upon it with the vaccine as well.
And I'll just add to that. Until these mutant strains of COVID began to appear, the SARS, the MERS, and now the COVID-19, until we had these mutational changes in coronavirus, it was just another virus that we experienced routinely. And I'm not sure many of the virology laboratories even paid a great deal of attention to it in the larger populations. We knew it was there, was sort of background noise.
Thank you. Now, specifically transitioning to children's vaccines. Dr. Nicholas, can you share strategies that can help improve children's vaccination rates?
Well, so probably the most important thing is to make sure that as a parent, you're bringing your child in for the routine health screenings with the schedule that's recommended by your primary care physician or your pediatrician. If you do that, we will make sure that your child is completely up to date and has all of the immunizations that your child needs to be protected. And then secondly, to go to school. Children now in the state of Pennsylvania do have to have their immunization series completed before they can start kindergarten. That is very important. And so the schools are checking up. So the second way to do that, obviously, is to try to register your child, because if your child isn't completely immunized, the school district will make sure that your child does get immunized. I think that a lot of parents have concerns about vaccines. Please, please, please talk with your healthcare provider. We are more than happy to have a very in-depth conversation about what vaccines mean, about the vaccines that are incredibly important to your child, and especially in special healthcare situations, either because of your family situation or because of your child's health conditions, what might be required over and above the regular and routine immunizations that we provide.
Thank you, Dr. Nicholas. Dr. Harkness, I believe this question probably comes from a healthcare professional. Where would I find professional information to share with parents on the importance of vaccines to protect children?
Okay. Where I find information mostly is from the CDC and the American Academy of Pediatrics. That's my go-to places. Now, unfortunately, I know the CDC has been kind of dragged through the mud through this whole thing by people who are not supporters of vaccines. They seem to put them up as kind of in the pocket of the drug companies. So what I actually use for parents is I like to use websites that are not dependent on any drug company money at all. They get absolutely no donations or no funding from drug companies. My favorites are, one is called the Immunization Action Coalition. It's www.immunize.org. That's a wonderful one. That has lots of information and lots of answers on any questions you have about vaccines. It's the first thing I give our medical students when they come into us. The second one I use is the CHOP Vaccine Education Center. Even though it's part of CHOP, it gets no money from drug companies at all. And that I always have trouble figuring out the URL for that. So I always Google CHOP Vaccine Education Center, and it's the first thing that comes up. And they've got a lot of information, especially about things like ingredients in vaccines and vaccines and different side effects. And then the third one is one I really like called Voices for Vaccines. That's one that's parent run. It's run by Karen Ernst, who's a parent and who is a strong vaccine advocate. And she runs a great website and has a great podcast about vaccines. And that you can Google that, but that's voicesforvaccines.com. But those three are actually really good sites that I give to parents to say, here, it has nothing to do with the CDC or organized medicine or government or anything. These are just three sites supported by people who really care about kids and vaccines.
Thank you, Dr. Harkness. I did just Google the CHOP Vaccine Education Center, and it is a fairly long URL, so it's probably better to use your method of Googling. Dr. Shapiro, why does my baby need these vaccines if the diseases are rare now?
This is probably the most important question that I've been honored to answer, ladies and gentlemen. And I want to answer it indirectly by letting you know that the rarity of a disease does not mean that the disease is gone or is not harmful. Let me give you a few examples of this. I think the easiest one for you to understand really reflects on what we went through with measles vaccine. Measles is a live virus vaccine. In the past, it was as frequent as 1 in 5 children got measles, was infected with measles. In 1963, I pulled these facts out. Measles itself, the illness, killed 2.6 million children and probably some adults globally. In 2021, while you know all of your children are receiving this vaccine, there were still 128,000 deaths in that year from measles throughout the world. So with the hope that you understand that while these diseases seem irrelevant to us in our society, in the societies that we're living in America, these diseases are not gone. They're not eradicated, with the single exception that you probably have read about, that smallpox is basically eradicated from the world. And even that, in that respect, you read about monkeypox a few months ago, and that began to reappear, but it has obviously taken a different direction. So to just answer your question with that one example, I think is more than adequate to make you aware, all of you aware, that giving vaccines makes it likely that your child and your children will be safer, but in no way does it take away and make light of the fact that the disease is less common in the world that you're living in. And that is so true with COVID. Yes, the vaccine has done marvelous things, and that blended with the number of people who have gotten the vaccine, gotten COVID, spread the virus around, we are now seeing a totally different position in our populations, with the obvious change being the number of deaths that occurred. I mean, there's no way to speak around the fact that until we got these vaccines up and running and distributed, 1 million people died. We changed the age length of life in America because of what happened with COVID. So I urge you to take this very seriously and use the example that I gave you as something that you're familiar with, measles. Even with all of the incredible work we do with measles vaccine, there was still an uptick in the number of cases a few years back when we let down our guard slightly amongst college-age students. So I urge you to just keep that in your minds. Remember measles when you think of COVID, and you'll never make a mistake in decision-making around COVID vaccine and other vaccines for your child.
Thank you, Dr. Shapiro, and I'm going to add 2 examples to the one that you had described. If you go back about 4 years ago, we actually had a small outbreak of mumps in Montgomery County. And that was mostly in college-age students. But that was a vaccine-preventable disease that potentially could have been worse had not more people been in. Not long ago, this fall, there was a significant outbreak of polio in New York that we've been following. And we were concerned that there would be spread of that as well. So these are both diseases that people don't think of as being very common, yet we will still see them. So there is definitely a reason to continue immunizing.
To the credit of the health department in Pennsylvania, when there was an outbreak of polio in the Lancaster County area, yes, the health department came in carefully and assiduously said, you need to immunize. And polio went down, polio went away. You've got to remember, ladies and gentlemen, on the back of all the doors of my exam rooms, we have a poster of all the diseases that vaccines will treat, and that we very fortunately rarely see. And the kids all look at the pictures when the door is closed in my exam rooms, say, what's that one? What's that one? And I can honestly say that the good news is most of them are very uncommon, but they're still there. they're still there and we still have to think about.
Thank you. Dr. Nicholas, very, very common question. Can it harm my child to get several vaccines at one time?
So I think as we've had more and more vaccines that our young children get, there's been lots of combination vaccines created because most parents are concerned about literally about the number of needle sticks that their children are getting. What we found though is that postponing those vaccines sometimes leads to not getting the appropriate vaccines, and then we have these little outbreaks that we just talked about. For example, polio and mumps and measles and some other things because we're missing vaccines for children and we're not getting them caught up appropriately. So I think the studies that are done when there are combination vaccines are done very rigorously to make sure that there is no harm to children. And as Dr. Shapiro, talked about with the COVID vaccine, all of the stages of testing that is done with every vaccine and every combination vaccine that comes out. I feel very comfortable in the vaccine combinations that we have available for our children. And as a result of being able to combine these vaccines, we're able to give a lot of vaccines, a couple of vaccines at the same time and not have to stick the child multiple times, which is the scary part of the vaccine, especially, it's in some ways easier to give it to the young children. The 3 and 4-year-olds call you bad names and pitch a fit and all the things, because obviously they, their older brother or sister teaches them about getting stuck with a needle. So I would say I do feel that they're safe. We have had lots of combination vaccines out there, and we're not seeing any decrease in the immunity that we see with the vaccine, nor are we seeing any increase in the side effect profiles.
Thank you, Dr. Nicholas. Dr. Harkness, do vaccines cause long-term side effects, and will getting a vaccine permanently hurt my child's health?
Yeah, the simple answer to that is no. We've never seen vaccines do have side effects. As I said before, they can give you fever, they can give you redness at the site of the site of the injection. They can make kids irritable sometimes. All of these are very short-lived, usually within 1 to 3 days. And they're all very mild. It's very rare to have any kind of bad side effect with any of the vaccines. Vaccines don't seem to give any long-term side effects. The longest reactions that we've ever seen from vaccines were with an old rotavirus vaccine that's no longer in use. We used to see kids get an intestinal problem with that, and that could come up to 8 weeks after they got the vaccine. And with the MMR vaccine, you rarely will see people, very rarely will see people get a mild transient arthritis up to 6 weeks or so after getting the vaccine. But other than that, any vaccine side effects that we see have always been within 6 to 8 weeks. We've never had a vaccine side effect that has gone long, that has come up longer than 6 to 8 weeks from getting the vaccine. With the COVID vaccine, again, we have not seen any long-term side effects with that as well. So we're actually pretty comfortable that they're very safe and that we don't have any kind of long-term side effects. When you hear people on social media talk about long-term side effects, or really talk about any side effects for vaccines, you'll occasionally hear, you'll hear a lot of anti-vaccine people who say, oh, this happened to this person or this happened to this person. You're never going to see somebody who says, we looked at this large group of people who got vaccines and compared them to this large group of people that didn't get vaccines, and here's the differences that we had. Because those studies have never shown any kind of difference between the two. They've been done. They've looked at large groups of people that have gotten vaccines, compared them to large groups of people that didn't, and have not been able to find any kind of neurologic problem, autism, any kind of problem with the people who got the vaccines versus didn't. So no, very comfortable that there's not any kind of long-term health effects on your child other than immunity and hopefully health.
Thank you, Dr. Harkness. Dr. Shapiro, are the ingredients in vaccines safe? And aren't aluminum and mercury dangerous?
I hope that, ladies and gentlemen, I hope this answer gets through to as many of your friends, colleagues, and as many different agencies as possible. because it's a very, actually, it's not a complicated answer. It's just a thread of a false fact that has lingered in the social media more than obviously in the medical literature, that there are problems with various vaccines. Let me put one thing to rest immediately, that thimerosal, which is the mercury-like compound that has been used, was used in the past. Notice I said past tense, was used in the past, that as a mercury is derived from a mercurial process, is no longer used in any vaccine. The only vaccines that you still see any thimerosal in, and there are plenty of preservative-free flu vaccines now, is the flu vaccine. So you still can get you can get some flu vaccines with some thimerosal. That's number one. Put that in your memory banks and make sure it stays there. There is just nothing to worry about with thimerosal because it's just not used. The second one is a little more complicated. Aluminum. Aluminum alum, which is the essential chemical construct for aluminum, is a byproduct that is used in vaccinology on a regular basis as an adjuvant. What is an adjuvant? An adjuvant is kind of like something you put into a recipe for a cake that makes the cake that much better, that you all know if you add is going to make that cake that much better. That's what alum is. And alum is added to vaccines in the development process to see how much boosting the alum can give to that vaccine product that is being tested to improve its immunogenicity. In other words, how it reacts in the body, in your child's body, in your bodies for that matter. I did a little bit of research also on the issues of on aluminum, And in an article that was published in 2003 in Pediatrics, it was a pretty complete study that showed alum was a very effective adjuvant, as I've just described, but that in that study that was done in Pediatrics, and I have the reference for you if you'd like, there was no known biologic function of aluminum in any byproduct of its chemical construct. Aluminum appears in many foods, and to the extent that it has any effect on bone density and on bone growth, it really does not reflect in any way in children in a negative or an adverse way. I'm not an adult physician, Dr. Lorraine. Dr. Nicholas, you can perhaps comment on aluminum in adults, but from my perspective and from the pediatric view, we really don't have anything to worry about with respect to aluminum. And alum, as I said, is a very effective and readily used adjuvant to boost the immunologic effect of certain vaccines.
Yeah, I would agree with Dr. Shapiro. I'm not aware of anything that alum would adversely affect. And, I think in a lot of cases, if it's not affecting young children, for sure it's not going to affect adults, especially in this situation. So I agree with you.
Can I also mention, when I have parents who are concerned about mercury, I can reassure them that mercury hasn't been in any of our vaccines since 2001. But by the way, it's still in breast milk. There's always been more mercury in breast milk than there ever was in the vaccines. So mercury is kind of a natural product that's in the earth. I mean, the aluminum is the most common element in the Earth's crust. So for people who want to be to an aluminum or a mercury-free environment, I think you have to go to Mars because it's here and it's in our planet. So, but the mercury we haven't had in the vaccines for a number of years.
Thank you all. Dr. Nicholas, should my child get shots if they are sick?
Well, so I think we worry about giving children shots when they're sick because is it going to make them feel that much worse? But what we know is that when your child does not receive their vaccines on time, that's when we start to have misses and skips and not keeping up with the routine vaccine schedule. Unless your child is very severely ill, the studies have shown that it is very safe for your children to have vaccines when they're sick. So if they have a cough or a cold or a low-grade temperature, I'd say, under 100.5, And many studies, many offices use 101 actually for a fever. It is very safe for your child to receive vaccines. I think if your child has a severe illness, short of breath, vomiting, a GI bug of some kind where they really can't keep anything down, it might be wise to delay for a couple of days. But other than that, we typically and routinely give children who have minor coughs and colds and runny noses and all the other things that children get their vaccines when they're in the office.
Thank you, Dr. Nicholas. Dr. Harkness, I'm going to unfairly put a limit on you for this because we're starting to run a little short of time. And this is, of course, a big question. It's actually also asked as proving the negative, but how do you know vaccines don't cause autism?
Okay, I can answer very quickly. The autism debate started back in 1998 with a gentleman named Andrew Wakefield, put out 2 studies that made that suggestion. Those studies have been retracted. It turns out he had lots of conflict of interest with those studies. The investigative reporters have found that a lot of the information he shared was not true. He's lost his medical license in England. He's now, I think, in Texas. Since that time, we've been fighting that debate since that time, and there have been over 25 different studies who have looked at huge number of kids in the millions and looked at kids who've had MMR vaccine and kids who haven't. And there's absolutely no difference between the 2 groups in the incidence of autism or in any neurologic disease at all. So that's been studied over 25 times with huge numbers of kids. And we're very confident that it's not from the vaccines. We know that autism probably starts in utero. It probably starts before the baby's born with genetic problems in the brain. And we know that vaccines can't do that because the kids haven't gotten vaccines yet.
Thank you. Dr. Shapiro, can my child get a disease from a vaccine?
Very quick answer. The answer is if it does happen, it is an incredibly rare event. Dr. Harkness already explained the issue of myocarditis very well. I don't need to repeat that except to say that the incidence of myocarditis from COVID vaccine, which is very mild and self-limiting, is actually when it was statistically evaluated in a larger population. In a meta-analysis of all the children who received COVID, along with the actual incidence of myocarditis, the data showed that the incidence of COVID-related myocarditis was lower than the average than the occurrence rate in the population, in the same age population. I could find one other interesting study about Kawasaki disease related to pneumococcal vaccine and rotavirus. But again, within 28 days of the vaccination, the data suggested that there's no clustering or no repetitive nature of the disorder. So therefore, I would say to you, as I answered earlier, diseases from vaccine are extraordinarily rare. And we do have a vaccine adverse reporting system through the CDC, whereby if Dr. Harkness or Dr. Nicholas or any of us have a case of an unusual reaction, you fill out a paper, send it in, and then the scholars will look at it and the scientists will look at it and see if there's any real merit to the results.
Thank you, Dr. Shapiro. Along those lines, a question that relates to this very often from parents or for individuals getting any vaccine is they're concerned if they can get the actual disease that the vaccine is designed to prevent from the vaccine itself. And there have been in the past, it's called live attenuated vaccines that actually have a weakened form of the actual virus, typically it's virus, in the vaccine. And it is theoretically possible to get that actual illness from those vaccines. For the most part, those vaccines are no longer available. A most notable example of this was the discontinuation of the oral polio vaccine. That was a live attenuated virus, and there were some cases of polio from that. So at this point, it's only an inactivated, injectable form, no longer the oral being given. This is a fairly broad question as well. Dr. Nicholas, how long does immunity last after getting a vaccine?
That is an incredibly complicated question. And so time is short, so I'll kind of shorten my response to this as well. It depends on the medical circumstance of the child or patient. It also depends on, remember, I think Dr. Shapiro talked a little bit earlier about memory cells. So the whole idea of a vaccine is to introduce the virus in a mutated form, but a piece of the virus that the body says, oh, I'm going to remember that. And then, then the cells kind of multiply, and then they go back into their dormant form. And so the next time you get a vaccine, the cells say, aha, I remember that. And then they multiply again, and then they go back into dormant form because they're not seeing any more of it. And it just keeps remembering and building up a memory, sort of like studying for a test over and over and over again. So that if your child is 7 or 10 or 15 and sees that virus, the body remembers it and you don't actually break out with the illness. So there are some vaccines that last very long time, and there are some vaccines that have shorter times, and you need booster shots as a result of that. So every vaccine is a little bit different, and everybody's body is a little bit different. And so, for example, for some of us in healthcare, we might have to go and have a whole series of blood drawn to make sure that we're still immune to some of the viruses that we may see probably more frequently than someone in the general public would, just to make sure that we really are immune to things. Again, depends on the child, the age of the child. It depends on the vaccine we're talking about. But the idea is that for the most part, you have a fair amount of immunity left, even 10 or 15 or 20 years later, so that if you see that virus, your body will remember and then create the immune response to prevent you from getting that virus itself, the illness itself.
Thank you, Dr. Nicholas. For our final submitted question, we'll go to Dr. Harkness, and this is a good one to kind of summarize what we've been talking about tonight. Why is it important for children to stay up to date on recommended vaccines?
It's a very good question, a very easy question, and that is that in the United States, we have very low rates of vaccine preventable diseases, and the rest of the world is not consistently like that. And as you know, the rest of the world is just a plane ride away. So somebody can step off a plane from anywhere into Philadelphia Airport or wherever and bring a disease with them. So we still need to be vigilant because the diseases are still out there. Even if we're not seeing them a lot in this country, they're out there worldwide, and we need to be protected.
Very good. Thank you, Dr. Harkness. And with that, we've come to the end of our pre-submitted questions. We do have one question submitted this evening, and I'll read that out. I think I'm going to just throw this out for all three of you, whoever wants to take a shot at this one. Can you please talk about vaccines recommended for adolescents? Which vaccines are recommended? When should my child get them? Why are they recommended for preteens and teens and not when they are younger or older? It's a fairly large question.
Okay. I can start with what vaccines are recommended. The vaccines, we have a little bit of a lull between age 5 and age 11. And at age 11, kids are supposed to get several vaccines. They get the Tdap, or the tetanus, diphtheria, and pertussis vaccine, which is their tetanus shot and their whooping cough shot. They also get a meningococcal vaccine, a meningitis vaccine, which is actually a very important one against a really serious disease. And they also get their HPV vaccine, which protects against a virus that causes cancers and genital warts and different bad things throughout the body. So those three should all be done at age 11 or earlier for HPV. They also get other meningococcal diseases or meningococcal vaccines at age 16, and then we also give them at 17 and 18 as well. So these are recommended for preteens and teens for two reasons. One, for things like the Tdap vaccine, that's a booster, and it's not really needed for about 5 to 6 years after the last dose is given. So we don't really need it till they're 11. And for the other vaccines, the meningococcal vaccine and the HPV vaccine, the way they were studied, they were really only studied extensively in kids down to age 11. So since we, or to age 9. So since we only have data for kids down to those ages, that's why we don't give them earlier. So check with your healthcare professional, and they will talk to you about which vaccines are recommended when. And we do this every day. It's kind of like second nature to us, so we can always go over them with you.
Let me just add a little bit, take a tangential answer to that question, ladies and gentlemen. When we see moms having babies during pregnancy, your obstetrician will say to you, we're going to give the pregnant mom an additional dose of the adult DPT vaccine. Why? Because we know that not everybody's immune system reads the book, and the immune systems are all variant at different times. The last thing we want is for a mom to in any way expose the unborn fetus to an illness that is vaccine preventable. And the one I'm talking most about is pertussis, or whooping cough. So by example, that's a good thinking process for you to remember, ladies and gentlemen, that giving a dose of vaccine at any time is precisely directed at making sure the immune system is primed for protection when that particular illness can come along. And as Dr. Harkness said, the meningococcal vaccine, we give the meningococcal B vaccine strain as late as possible in our experience with children. Just before you end your high school years, we'll give it for the sole purpose of making sure those of you who go on to higher education or into other positions are protected for the period of time when we see that little blip of illness from the particular organism that we're protecting you from. So all of it is about timing. And if we can help you understand that, you moms and dads, to understand what the best timing is. We know what the suggested recipe for vaccine or the suggested schedule for vaccines are. We'd like to keep to it, but we also know that the time of administration often correlates to when we need to protect your child the most.
Can I also add too that I know we're not talking about vaccines in pregnant women, but there are 3 vaccines that are given in pregnant women: COVID vaccine, flu vaccine, and the Tdap that Dr. Shapiro mentioned. And those actually protect the pregnant women because they're at higher risk for complications from those disease. But it also gives them antibodies that cross over the placenta to protect the baby for the first few months until the baby can start getting vaccinated. So that's another reason that we give it to pregnant women, to try and protect the newborns.
Thank you. I think we addressed that question quite completely. Well, we've reached the end of our questions for this evening, and I would like to give it back to our panelists for one last thought in terms of particular things that they would like to kind of summarize in 1 minute each. So for that, first, I will start with Dr. Nicholas.
I think, the past couple of years have been, I think, tough on all of us, but I feel, and I was actually commenting today, walking through a hospital, that at some point we're going to get rid of these masks and we're going to really feel like it's back in 2019. I think your healthcare providers are here. We are happy to see you. We're happy to talk about the routine recommendations. Things really haven't changed much for recommendations, but we want to make sure that your children are caught up with all of their vaccines. Vaccines are so incredibly important to make sure that we are preventing illnesses that can and should be prevented. I think all of us have talked about things that happen in other parts of the world where they don't have vaccines, and children do die of things that I personally have never seen in my own career, and I've been a physician now for over 30 years. So it's really important that your children are up to date. Please bring your kids into your healthcare provider, make sure they're up to date, and make sure you and your family are all up to date on all of your immunizations and healthcare screenings as well.
Thank you, Dr. Nicholas. And for final thoughts, Dr. Shapiro.
Thank you very much for the opportunity to share the information that I've given to you as a group. There's always going to be questions. As Dr. Nicholas indicated, just ask us. We're here for you. We only have the best interests of your child or children in mind. We're not trying to overload. We're trying to do as the best information comes available, give your child, your children, every opportunity to remain as healthy and safe as they possibly can. Thanks again for listening, and thank you to Beth and Kelly for asking me to join you.
Thank you, Dr. Shapiro and Dr. Harkness.
Right, the pressure's on being the last. I'm echoing the same thing that Dr. Nicholas and Dr. Shapiro said. It's okay to be concerned. It's okay to be hesitant. There's been a lot of misinformation out there about vaccines. We all know, we all read the same things. We're on the same social media. We're here to help. We look into these things when they come up. We try and get as much good information as we can. So if you have questions, please come to us. Please come to your healthcare providers and say, hey, I've read this, I've looked at this, I'm concerned about this. What do you think? And we'll be happy to go through it